Doctor, you talked about cancer a little bit. You're certainly an expert in that field. There's so many different tests for different types of cancer out there, screening tests, mammograms, prostate. I mean, the list goes on and on. Are those worth it? Is there benefit to those tests?
Absolutely not. Scott, cancer is cancer. And the only two ways to define cancer or give it a name is to name it where it occurs. If it occurs in the liver, you have liver cancer, you know, kidney or skin cancer and so on. Or the way you diagnose it or basically find out about it in the laboratory setting. The way basically the test is done. You know, Hodgkin's disease, non-Hodgkin's disease. It only is determined by how you basically find it in the laboratory. So they name it after somebody or after somebody's test, or they name it where it occurs. Cancer is cancer. And cancer is nothing else than a total breakdown of energy. We are all born with cancer. From the very first moment we are born, we have cancerous potential cancerous cells in our body. So from day one, our immune system grabs the mutated, atrophied, dead, half-dead cells, whatever they are, and just gets rid of it. So now we need to ask ourselves 20, 30, 40 years later, what in the world happened that changed my energy level to a point that my immune system cannot do its normal function, that it's used to do, keeping me alive, keeping me clean, keeping me healthy for the last 10, 20, 30, 40, 50, 60 years. Because our immune system is trained for that, used to it, did it all the time. The diagnosis of cancer or the name of your cancer has absolutely no impact on your recovery rate, has no impact on what treatment you should get, because by law, Scott, a medical doctor in the United States has to apply chemotherapy, radiation, and surgery to cancer, to a cancer patient. So first of all, what does it matter what kind of cancer you have or where your cancer is or how they prognose it or diagnose it in the laboratory if you get the same treatment anyway? If we just step back and use common sense and say all this testing, like mammographies, raise the cancer risk at least 2%, with every mammography, putting 50 pounds of pressure in the most gland-loaded tissue of a female body, the breast, putting 50 pounds of pressure on it. That is absurd. And then radiating it, it's a crime. If you imagine a lymph node, our immune system, our physical immune system is basically our lymph system. And we have 4 times more lymph liquid than blood. And we basically, we really shorten it down to it, our lymph system is our physical immune system. So the lymph nodes, they are collecting the poisons and are like a chemical plant and neutralizing the poisons so that the body can eliminate them. Okay. Now imagine this same lymph node has so many poisons in it that it is really, really like a pimple. You know, like sometimes you look at somebody and he has a pimple on the forehead and you want to squeeze it. And imagine the lymph node is that poisonous, this inflamed, this infected, ready to burst. And now you use mammography and you put 50 pounds of pressure on this lymph node. It just bursts. That's how they give you potentially breast cancer. Or you have a needle biopsy. People don't understand that the cancerous tumor is the approach of the body to save your life. You have so many poisons in your system that these toxins are going to kill you. Now the body builds a bag and collects all the poisons from your body in this bag and isolates it. Saves your life. The medical profession calls this a tumor. That's why they say, oh, a cancerous tumor is always very, very toxic in the inside. Of course it is, because all the toxins from your body are in there. So now imagine you have a balloon, like a regular blow-up balloon filled with water, really to its max. And now you come with a needle or needle biopsy, and you pinch into this balloon. It bursts and all the water runs out, and in this case with a needle biopsy, the lymph node or the cancerous tumor bursts, and all the toxins are poured into the system. And now they're not all over. They are concentrated on one single spot. And now these people have, due to a miracle, very fast growing and a very aggressive cancer overnight. They didn't have that cancer before. They got this cancer that day with a needle biopsy or with a mammography or whatever might be out there. So to answer your question with a long loop, early detection doesn't, statistically even, doesn't make any sense. They just start killing you earlier. If you just imagine breast cancer, for example, goes for 7 to 10 years to a size that you can even diagnose it. It grows 7 to 10 years. Let's say a woman is 70 years old. And it grew for 10 years to a size, the head of a needle pin. Now it can go another 10 years to double the size. Now the woman is 80-ish. So the average lifespan is about 80, 83, 86 for a woman. So why even start slaughtering this poor woman? Why even bother? Because nothing will happen. I don't know if you remember, Scott, my own grandmother had a bad lymph node in her breast for 28 years. It didn't grow. It wasn't bad. And then a medical doctor, a young medical doctor, talked her into surgery, scared her into surgery, and she started dying for the next 3 years, the most horrible death I've ever seen. But for 28 years, she had this lymph node in her breast. It was cancerous. It didn't grow. It didn't do anything. It didn't hurt, nothing. And so we need to start using more common sense. If you diagnose a cancer, what do you do with this information? As a medical doctor, chemo, radiation, surgery. So you have skin cancer, what do you do? Chemo, radiation, surgery. You have liver cancer, what do you do? So their approach is always the same. So early diagnostic and all these different tests only do one thing. It adds to the $162 billion a year that the early diagnostic and the research community for cancer is swallowing every single year. The cancer industry itself, treatment, is a $60 billion industry. The cancer prevention and early detection is a $162 billion industry. And here, Scott, is your answer. The only reason to work for all these early detection techniques, all these early prognostics, all these specific diagnostic techniques, with a 90-year-old woman, that's why this came up to my head, my hair cutter, cutting the rest of what's left, she told me that her mom, they said her mom has an 0.1% chance there is something wrong with her, and they want to do all this testing. This woman is 90 years old. They want to do all this testing to make sure there's nothing wrong. It's laughable. It's a joke. And even if they find it, what do they do then? Now they do chemo, radiation, but a 90-year-old woman, it is just ridiculous. And to conclude that answer, their early detection methods are only created to make earlier customers so that they can treat the cancer patients longer, because statistics show if you treat a cancer patients with chemo, radiation, and surgery, they might live 17 days longer than people that are not treated. But the people that are not treated with that, they have quality of life. They still have their hair. They still look good. But the second you get into the medical treatment, you lose your hair, your fingernails, your teeth rot out, you turn blind, you die early, and there's no quality of life to begin with anymore. On the other hand, there are 400 known natural cancer cures out there. So why even consider a medical doctor? And I just remembered, because I said it yesterday at my speech, National Geographic conducted a study with 100-year-old people. And not people that were dying, people that were 100-year-old and vital and fit and have a high quality of life. And the absolute only thing they had in common, not diet, not exercise, nothing. The absolute only thing they all had in common was they never went to a doctor. You know, I mean, they broke their leg or something, different story, accidents. But they all never went to a doctor. And that's, I think, is very, very significant.
Yeah.